A 27-year-old female presents with severe finger deformities and joint laxity. I am showing you a posteroanterior radiograph of both hands. Please describe the findings.
The radiograph demonstrates severe, bilateral, symmetric deformities of the metacarpophalangeal and interphalangeal joints. There is ulnar deviation of the fingers and swan neck deformities, but notably, there are no bony erosions or joint space narrowing.
What is your primary diagnosis?
The combination of severe, symmetric deformities without bony erosions or cartilage loss is classic for Jacquard's arthropathy in the setting of systemic lupus erythematosus.
What is the underlying pathophysiology of Jacquard's arthropathy, and how does it differ from rheumatoid arthritis?
Jacquard's arthropathy is caused by ligamentous laxity, joint capsule retraction, and muscle imbalance rather than joint destruction. Rheumatoid arthritis, conversely, is driven by an inflammatory synovitis that directly destroys bone and cartilage, causing marginal erosions.
What is the characteristic clinical hallmark regarding the nature of these deformities during physical examination?
The clinical hallmark is that these deformities are initially fully reversible or reducible with passive manipulation, as the underlying bone is not destroyed.
What is the term used when a patient with systemic lupus erythematosus demonstrates both deforming arthropathy and true bony erosions?
This is known as Rupus syndrome. It represents either a rare overlap syndrome of systemic lupus erythematosus and rheumatoid arthritis, or a severe, erosive variant of lupus arthropathy.
How does Jacquard's arthropathy typically present on hand radiographs, and which joints are most severely affected?
It presents with ulnar deviation at the MCP joints, swan neck or boutonniere deformities, and subluxations. The MCP and PIP joints are most severely affected, while bone mineralization remains normal.
What is the differential diagnosis for a deforming, non-erosive arthropathy?
The main differential is post-inflammatory Jacquard's arthropathy secondary to rheumatic fever. Other rare causes include scleroderma, dermatomyositis, and hypermobility syndromes.
Finally, what are your clinical management recommendations?
I recommend referring the patient to a rheumatologist for systemic lupus management. Hand therapy, splinting, and conservative medical management with NSAIDs or corticosteroids are typically recommended.